Senator Wyden.
Thank you, Mr. Chairman. Mr. Chairman, I want to echo your comments with respect to health care costs. And for our witnesses, this week's Congressional Quarterly, the cover page says, "A crisis in plain sight. As Washington does nothing, the challenge of an aging population is quickly overwhelming the system." And that is why I'd like to turn to Medicare to get a reaction from both of you. The longer I go, and of course the program has changed pretty dramatically since Gray Panther days, and I think I've talked about this with both of you. The ball game, to a great extent, is those with multiple chronic conditions. 70% of Medicare costs go for those with 3 or more multiple chronic conditions. So to a great extent, if we can find ways to ensure that those folks get quality care that is more affordable, we're going to go a long way to fixing Medicare. Now, I think there generally is bipartisan support for approaches that integrate services, that we move away from this approach where someone who, say, has diabetes or pulmonary health issues just goes and gets services physician by physician and ends up without a care plan and eventually goes to the hospital emergency room. The accountable care organizations go certainly in the right direction in this regard, but it seems to me that considerably more has to be done. And I'd be interested in your views on this question of how we're going to deal with what I think is really the heart of an effective reform strategy with Medicare, and that is dealing with those with multiple chronic conditions. And either one of you to go first.
Well, I think you're absolutely right, Senator, and this is just the sort of thing I had in mind when I said we don't have all the knowledge we need right now to write a piece of legislation that mandates how to do the care integration. We have more to learn. Some of the innovations going on in the private sector are hopeful. As you know, there are individual examples of individual medical systems that do it better and save money. There also is a whole array of state-run demonstration projects, particularly focusing on integrating care better for the dual eligibles that are starting up this year. And we need to pursue these and rigorously evaluate these and try and set ourselves a goal that as we learn how to do this in ways that both improve quality and save money, as you suggest, then we need to adopt them and implement them in Medicare and Medicaid. Sadly, we don't have the silver bullet or know exactly how to do it yet, but as you say, it's one of the most important things for us to learn and adopt as we find the answers.
Again, it's a very important problem. The Medicare system was designed for an era of acute care as the primary medical expense. We now have chronic care as its leading problem and multiple comorbidities as the typical expensive Medicare patient. So moving the focus on that and integrated care is very important. I would say a couple things. Number one, I've started an organization called the Partnership for the Future of Medicare with Ken Thorpe, a bipartisan effort to guide reforms that are sustainable for Medicare. We've put out some, quote, guardrails, good do's and don'ts on Medicare reform, which I can provide to you and would be happy to. And one of the things that going forward is we need more options that provide the integrated care. We are concerned about the cuts to Medicare Advantage because it's an integrated platform. You may or may not like that. I don't want to get into debate over Medicare Advantage per se, but having less, not more, is a mistake. You need patient buy-in. You cannot simply litter the landscape with smart health innovations and expect the world to change. Patients have to buy in both personally and financially to get it done.
Can I interrupt you on that point? Because Senator Portman is here, and he and I have introduced the first bill that essentially would reward those who stop smoking, lower their blood pressure, lower their cholesterol. It's really based on the work that was done at the Cleveland Clinic and Oregon Health Sciences Center. I gather that you feel that those kinds of behavioral changes, it's time that that would be part of the program.
Yeah, and I'd love to see. I don't know the specifics. I'd be happy to look at it.
Mr. Greenstein, you all right with that? Because I think in Senator Baucus, we remember that in the Affordable Care Act, we began to start to integrate those preventive incentives, and Senator Carper did some particularly good work on that, as we recall, for those under 65, but we haven't begun to build that in in terms of those over 65, and I think Oregon Health Sciences and the Cleveland Clinic kind of provide that model, and I think it's time for those kind of behavioral changes, and I appreciate both of you being interested. My time is up, Mr. Chairman.
Thanks, Senator Grassley.